We're sure you're excited about the prospect of being able to see clearly after cataract surgery, and for good reason. Every year, over 2 million patients are diagnosed with cataracts and have their vision successfully restored with cataract and lens implantation surgery. But having cataract surgery, like any other medical procedure, has both risks and benefits associated with it. Even with the best of care, you could experience some of the side effects or complications mentioned in this program. Before giving your consent for surgery, we'd like you to view this educational program in its entirety. At the end of the program, there will be a short quiz, just to make sure you understand the important information presented in this program. A cataract is a clouding of the eye's natural lens inside the eye, located just behind the pupil. Before your cataract developed, your eye's natural lens was clear and allowed light rays to pass through it and focus clearly on your retina. But over time, your natural lens became cloudy, blocking light rays from reaching your retina. Cataracts can cause your vision to blur and your color perception to diminish. Left untreated, your cataracts could continue to develop to the point of causing blindness. In order for you to see clearly again, your cloudy natural lens needs to be surgically removed. And in its place, an artificial intraocular lens, or IOL, will need to be implanted. There are many types of intraocular lenses that will improve the poor vision caused by your cataracts, along with any nearsightedness, farsightedness, or astigmatism that you may have. A standard monofocal IOL provides vision at only one point of focus, which is most often said to provide good distance vision. Standard monofocal IOLs, however, do not correct astigmatism. Astigmatism occurs when the cornea or outer window of the eye is more curved in one direction than in the other. This creates multiple points of focus on the retina and results in blurry vision. So, unless you have your astigmatism treated, your vision could still be blurry. If you have only a minor degree of astigmatism, your surgeon may be able to correct your astigmatism by placing microscopic arcuate incisions in the periphery of your cornea during your cataract procedure. If you have a moderate to high degree of astigmatism, you can choose to have an advanced monofocal toric IOL that has built-in astigmatism correction. Standard monofocal IOLs can also be used to reduce one's dependence on glasses if you should elect to have monovision or blended vision. With monovision, the lens implant in your dominant eye would be set for distance vision, and the lens implant in your non-dominant eye would be set for near vision. Your brain then automatically selects either the near or distant image that you wish to see. Monovision is well tolerated by many patients, but not everyone, so it may not be right for you. Multifocal and accommodating IOLs are two different types of advanced IOLs that are designed to provide you with a broad range of vision when implanted in both eyes, allowing you to read and see in the distance with little, if any, dependence on glasses or contact lenses. Which IOL is best for you will depend on the unique characteristics of your eye, as well as your lifestyle needs. Your procedure will be performed in an outpatient surgical suite. Your eye will be completely numbed with eye drops or local anesthesia. Then, a small stair-stepped incision is made to the side to allow access to the cataract. Next, a circular opening is created in the capsular membrane that surrounds the natural lens to provide access to remove the cataract. Then, using an ultrasonic instrument, the cataract is gently broken apart and vacuumed from the eye. The intraocular lens that you choose is then inserted into the capsular membrane that held your natural lens. The stair-stepped incision is self-sealing, usually but not always requiring no sutures. You will be given instructions about any special medicines or treatments that will help with the healing process. It is very important that you follow all your post-operative instructions and that you return for all of your follow-up appointments. Your results depend on following your doctor's instructions. You will need to have someone drive you to and from your procedure. Do not drive yourself until your doctor has told you that you have legal driving vision. When you get home, you should just relax and enjoy the rest of the day and avoid any strenuous activity. You may experience mild discomfort in your eye for the first 12 to 24 hours. If you continue to experience pain that cannot be relieved by medication, notice an increase in redness, or have any questions at all, you should call our office. How well you will see immediately after surgery varies quite a bit from one person to another. Some patients see improvement in their vision immediately, while for others, vision may be blurry and fluctuate in clarity for several days to several weeks, or occasionally longer. Most people resume their normal activities within a day or two. It is important that you understand that virtually everyone will experience improvement in their vision after surgery, but some people will not see 20/20 at all distances or in all light levels. This can be influenced by the overall health of your eye, the condition of your retina, and the unique optical characteristics of the selected IOL that you chose. Also, as we get older, our ability to see in low light levels starts to decrease naturally, so it's always helpful to read under good light conditions. Although most patients are satisfied with their vision after cataract surgery, it is not uncommon to wear glasses for certain tasks, particularly at night or in dim light. It may take several months for your eye to reach its full focusing potential, and your vision can continue gradually improving for as long as a year after surgery. If you have cataracts in both eyes, your second eye may be done as soon as you regain functional vision in your first eye. Months or even years after cataract surgery, you may experience cloudy and blurry vision again, similar to the symptoms you experienced with your cataracts. This occurs when the capsular membrane that originally surrounded your natural lens and now holds your intraocular lens in place becomes cloudy. In order to restore clear vision when this occurs, the cloudy membrane is partially opened with a brief laser procedure called a YAG capsulotomy. You should understand that it is possible that your surgeon may encounter a condition or complication during surgery that would prevent you from having the type of lens implant that you chose prior to the procedure. It is also possible that the estimated power of the implant selected could be too strong or too weak. This would result in the need for you to wear glasses or have laser vision correction to fine-tune your vision. It might also require that your lens implant be surgically removed and replaced with another implant. Also, if you had your astigmatism corrected with arcuate incisions, there is a possibility that the effect could change over time. As with any type of corneal refractive surgery, this may require retreatment. Although cataract surgery is among the safest medical procedures performed today, side effects and complications could occur. Also, if you have any medical condition that you feel might put you more at risk, be sure to tell your doctor. If you choose to have an advanced lens implant such as a toric, accommodating, or multifocal IOL to reduce or eliminate your dependence on glasses or contact lenses, it is important to understand that you may not achieve the results you were expecting, nor is it possible for your doctor to guarantee your visual results. Should you choose to have a multifocal IOL, you will most likely notice glare and halos around lights, especially at night. Most patients report these visual side effects diminish in intensity over time as the brain adjusts to the multifocal lens. But these visual side effects may not go away completely. But here is the good news. According to the American Society of Cataract and Refractive Surgery, more than 98% of cataract patients have their vision successfully improved with cataract surgery. So very soon, you too should notice that a cataract is something that you can definitely live without. Now let's try a short quiz to see how well you understood the information in the program. Please circle true or false on your answer sheet. True or false? It may take months to a year for your eyes to reach their full focusing potential. True or false? If you choose an advanced IOL, you will be responsible for the additional costs. True or false? You may need to wear glasses from time to time after surgery, especially at night or in low light levels. True or false? It is not important to keep your follow-up appointments after surgery. True or false? Your doctor cannot guarantee that you will have the results you desire after the procedure. True or false? A standard monofocal IOL provides vision at only one point of focus and does not correct astigmatism. True or false? If you have astigmatism, it may require correcting with arcuate incisions or a toric IOL during your procedure, or laser vision correction after the procedure. True or false? It is possible that during the procedure, it may become necessary to implant a different type of IOL, other than the one planned. When you have completed this quiz, please grade your own test by comparing your answers to those found on the bottom of the page. You will also be given a written informed consent that covers additional information regarding risks and complications. Please read this document thoroughly and have all your questions answered by your doctor or a staff member before signing. Don't rely just on this program to make your decision whether to have the procedure. Thank you for your trust and confidence in choosing our clinic for your vision correction needs.